Hello, I'm Alfredo Ruggeri from Resono Ophthalmic, and I would like to give you a brief overview of the study done with Eleonora Fatigati and Luca Vigo from Carones Vision in Milan on the therapy with the Rexon-Eye device in severe mixed-type dry eye patients. Dry eye is a very complex disease characterized by several signs and many possible causes, as evidenced in the recent TIFOS Deuce 2 definition. It may range from mild discomfort up to severe corneal disorders for the patient. Nevertheless, the number of patients suffering from dry eye is very high, and in a recent paper it has been shown that its prevalence and incidence are even increasing for all ages. Various therapeutic options are, of course, available, but most of them address only the alleviation of symptoms at short or mid-term. The approach of the Rexon-Eye device is different because it addresses the real cause of the disease. The therapy is based on the delivery of a low-power electrical current applied to patients via the mask electrodes they wear on their closed eyes. This current is able to stimulate the natural regeneration of tissues and cells via an effect we call QMR, quantum molecular resonance. The treatment is not invasive, it is actually pleasant, and thanks to the regeneration effect, it is able to address the real cause of the disease. This allows for a long-lasting remission of symptoms. Moreover, the treatment has been shown to be effective in all types of dry eye, both evaporative as well as aqueous deficient. The QMR effect was actually discovered in the 80s with the goal to obtain a surgical cut without using heat. It was discovered that an electrical current at very specific frequencies, 4 MHz and harmonics, was able to maximize the transfer of energy to tissue and so to obtain the cut without wasting energy into heat. For this reason, the cut was non-traumatic, with temperatures always below 50 degrees, and brought several important benefits from a medical point of view. Later on, the same QMR effect was shown to be able to stimulate the natural regeneration of cells and tissue. This may be explained by observing several concurrent phenomena like the cell mechanical deformation, increase of calcium release and of metabolism, and adult stem cell generation, as reported in this paper. The capability of QMR to stimulate the natural tissue regeneration was more recently demonstrated also in a study on human mesenchymal cells using DNA microarray analysis. This study revealed transcriptional changes, in particular the upregulation of genes involved in the extracellular matrix remodeling, embryogenesis, and wound healing. You can find a full report of the study in this paper. Therefore, we apply this regeneration capability in ophthalmology and specifically to the dry eye disease. This study was carried out in 9 subjects with severe mixed-type dry eye, that is both evaporative as well as aqueous deficient, as evidenced by their clinical parameters reported here. The Rexon-Eye treatment protocol involved 4 sessions, once per week, and in each session the patient had just to sit for 20 minutes wearing the mask electrode on their closed eyes. Values of the applied electrical parameters reported here were such that the total delivered power was approximately between 10 and 12 watt. Patient evaluation was performed before the treatment and 2 months after the end of the treatment by measuring several parameters describing the patient's condition as regards tear and eye surface, and they are listed here. In this first table of results, the values for lipid layer, tear meniscus, and breakup time are reported. We can see that in most of the patients there is a marked improvement in all of these parameters. In this second table, results for OSDI, osmolarity, and inflammation are reported. And we can see that also here, for most of the patients, the improvement is really remarkable. In conclusion, the QMR treatment delivered by the Rexon-Eye device was able to induce a significant improvement in all the measured parameters and thus also in the overall patient's well-being, despite the complex and severe type of dry eye that affected these patients. In addition, many of these patients were treated from several months up to more than 1 year ago, and they all maintained those benefits in this period of time. These very encouraging results, however, needs to be confirmed in a larger cohort of such patients. Many thanks indeed for your attention, and please feel free to write us should you need more information about this study. And in the meantime, please be careful and stay healthy.